Now, today, the Epilepsy Society launched a campaign calling on the Health Secretary, Jeremy Hunt, to take action against avoidable deaths with epilepsy. The condition carries with it a greater risk of premature death, but research suggests that 39% of those deaths are avoidable through things like better care and treatment. Also worryingly, there's a variation in the standard of care throughout the UK, with sufferers, say in London, being 3% more likely to die early than in the rest of the country. With me now to tell us more is David Marshall, Interim Chief Executive of the Epilepsy Society. David, it's a big worrying statistics here somewhere. Why are we in this situation, do you think?
Well, the last national clinical audit that was undertaken in the UK was 14 years ago in 2002. And in that data, as you've pointed out, up to 39% of deaths are deemed avoidable. So what we really now need to understand is, have we moved on from there? And current indicators suggest we haven't. So we are urging, through the Epilepsy Society, to get Jeremy Hunt to commission a new national clinical audit into epilepsy-related deaths so that we have up-to-date data and can understand how, why and where to put better care, better treatment and better services for people living with epilepsy.
I mean, you obviously, the research would find out how, why and where, but your own initial feelings, what is it? Is there not enough training, not enough understanding between NHS trusts?
It's definitely a lack of access to specialist care, now whether that be through a neurologist or whether that be through specialist epilepsy-trained nurses, or in some cases access to a GP. Studies back in 2009, and we still think are relevant today, suggest that 60% of NHS trusts do not have specially trained epilepsy nurses. So patients aren't getting access to the care that they need at a time when they need it, and therefore we have patients who are at risk of premature death who may not necessarily know that they are at risk of premature death because they haven't had the right access to correct services, specialist treatment, and obviously the related drug treatment to assist them to remain seizure-free.
And one of the worries, presumably, with anyone who lives with epilepsy or who is close to anyone who does, is that research will take time. Getting to Jeremy Hunt could take time. Is there things that could be done more immediately to improve the status that we're in at the moment?
Well, the Epilepsy Society is urging our supporters, people living with epilepsy, and the public in general to please visit our website, epilepsysociety.org.uk, follow the link to petition your local MP to please ask Jeremy Hunt to urgently commission a new clinical audit study into epilepsy-related deaths so that we can reduce the number of avoidable deaths.
David Marshall there from the Epilepsy Society, and if you want to join that campaign, you can visit the Epilepsy Society website.